Alrighty, hello. So my name is Anaya Webb, and this is my week 2 return demonstration for Health Assessment 1. And this is my participant, which is my little sister. So we will go ahead and get started. Alrighty, so I'm going to knock on the door and I'm performing hand hygiene. Alrighty, hello, how are you doing today?
Good, how are you?
Alright, I'm fine. My name is Anaya. I'll be your student nurse today. I'm just going to do a general survey over you just to check your bodily functions. The survey should take about 5 minutes. I'm sorry, not survey, observation. It should take about 5 minutes to complete this assessment, and I do want to thank you for cooperating and giving me your time. Alright, so to start off the assessment, we will look at the patient's physical appearance. So the patient seems to be sitting upright. She appears to be her stated age and gender. Her skin is appropriate for her race. And the patient looks well nourished and healthy. So we're also going to check to see if the patient is alert and oriented. So by checking that, I'm just going to ask the patient a few questions. So alrighty, can you state today's date?
It is 5/17/2020.
Okay, and do you know the time?
4:33.
Alright, and do you know where you are right now?
My bedroom.
Alrighty, and could you please just state your name?
Amani Tillman.
Alright, so the patient seems to be alert and oriented ×4. She knows person, place, time, and date. So next we are going to check for the patient's range of motion to make sure that she has a steady and even gait. So if you can just stand up and kind of walk to that wall and walk back for me. Alright, so you can just take a seat. And thank you. Alright, so the patient, her range of motion is smooth. There is no need for assistive devices when she is walking. We're also going to check for the patient's mood and facial expression. So as I'm asking her questions, her facial expression and her mood is appropriate to the situation. The patient looks well groomed. Her clothes are also appropriate for the situation, for the weather. Alrighty, so next we will check for the patient's vital signs. We will check for blood pressure, temperature, pulse, respiration, and oxygen. So I have taken the patient's vitals, and I have got that her temperature is 98.4, her blood pressure is 120/84, her respirations are 16, and her pulse is 72, and her oxygen is 100%. So the patient's vitals is in the normal range. Alrighty, so now I'm going to reassess for pain and make sure that the patient is comfortable and if she needs anything. Alrighty, so are you having any pain at this time?
No.
Alrighty, so are you comfortable? Is there anything that I can do further for you? Alrighty, so I do want to thank you for letting me complete my assessment with you today, and you enjoy the rest of your day.
You too.
Alright, so I'm going to end the video with hand hygiene.